You should be seeing the opening slide of the presentation on your screen, and we will begin with the presentation momentarily. If you are having trouble hearing, please turn up your speakers or headphones. The presentation will take roughly 45 minutes, and then we will have 10 to 15 minutes for questions. If you look at the bottom right corner of your screen, you'll see a chat box. This is where you can submit questions at any time during the presentation, and we will do our best to answer as many as we can. Also, if you are having any issues with the webinar, you can use the chat box to let us know, and we'll do our best to help. At the end of question period, a very short survey will pop up on your screen. We'd like to ask you to please take a minute to complete the survey because your feedback will help us improve our webinars in the future. I'm Joanne Murphy, Chair of the RTO-ERO Foundation Board of Directors, and I'm very pleased to be here with Dr. Raza Mirza. Dr. Mirza's areas of expertise and teaching interest include research methods, medical decision-making, the socio-behavioral determinants of health in persons aging with a chronic illness, and factors influencing late life social, mental, and physical well-being. He has been an invited speaker at national and international gerontology and geriatrics conferences, workshops, and symposiums, and has consulted with various levels of government on diverse issues relating to an aging population. Dr. Mirza is currently a researcher at the University of Toronto's Institute for Life Course and Aging. He is also the network manager for the nonprofit organization, the National Initiative for the Care of the Elderly, or NICE, an international knowledge transfer network in the field of aging. He is the community lead for the Toronto HomeShare program and is the chair of the Central Ontario Age-Friendly Network. Dr. Mirza spoke at last year's Pension and Retirement Concern Committee meeting, and the audience was so impressed we had to have him come back and present at one of our 2019 webinars. In today's webinar, Dr. Mirza will discuss social isolation as both a process and an outcome. He will touch on promising ways to strengthen the connections that older adults have to communities, and how building and maintaining meaningful relationships at all ages may be the foundation for addressing and resolving the increasingly concerning issue of social isolation. Dr. Mirza, thank you for joining us today, and I will now turn the presentation over to you.
Well, thank you very much for that. I just want to say good afternoon, and thanks to both Joanne Sobey for inviting me here today. They're both in the room with me, so I'm happy to say that. And also to Joanne Murphy for that very kind introduction, and Mike Prentice for helping to make all of this happen. So as was mentioned, I will be talking to you about a topic that is gaining more and more attention as a major issue that may impact the health, wellness, and quality of life for older adults, and that's social isolation. And to all of you who are joining me today on this webinar, thank you, and I look forward to having a discussion with you at the end. So if you look at some of the headlines and the issue of social isolation itself, it's been on the research radar for quite some time. Studies going back to the early 1990s have flagged social isolation as an issue. But it was a study by Dr. Julianne Holt-Lundstad titled Loneliness and Social Isolation as Risk Factors for Mortality, which really drove the point home that social isolation and loneliness, terms that are often used synonymously, were not only problematic, but they were deadly. So since then, the media in particular has picked up on this issue, and perhaps after this webinar, you could conduct a simple Google search, kind of like what I did, and just search the terms social isolation, equivalent to smoking cigarettes, and see how the issue is being unpacked in popular news and media. If you haven't heard the statement before that social isolation is the equivalent to smoking 15 cigarettes, some of these news studies will highlight that. And I'm going to highlight that socially isolated individuals were seen to have hormonal changes, changes in levels of cortisol, and physiological changes that were health detrimental and comparable to being a smoker. Some of the headlines here that you can see on this slide highlight that the thinking around the issue has changed a little bit, to the point where the UK has appointed a minister responsible for loneliness. Social isolation and loneliness are now being recognized in the clinical setting. And I'm going to build on some of these points throughout this webinar. When we do talk about loneliness and isolation, which are not necessarily the same thing, what becomes very clear is that people are able to describe what it feels like being isolated. They can give examples of people that they might know who are at risk for isolation or might be at, the state of being isolated, but there is no real consensus about how to define the concept of social isolation. There are, however, a few common elements that I will talk about. If we focus on the image here and the quote that was shared to me by an older adult in a research study on social isolation, some of the elements of social isolation become a bit more clear. This individual had at some point been connected to their community and they had meaningful relationships, but something changed. And I hope to unpack some of these changes as we talk today. Now, I want you to reimagine this image as well and consider a weather change, kind of like what we're going through right now, the lack of benches that are there, and some other social and physical features of the built-in social environment that could help either problematize the issue or maybe help us address it in the future. So as part of today's webinar, I'll spend some time talking about what social isolation is, who this might impact, why it's important, and what we can do. I'm one of the many people who work in gerontology and geriatrics and have recognized that social isolation is a real pressing issue. But I think I have a different worry and a different spin on this topic. My worry is that people like you and I are at risk of social isolation, and not only will we not recognize that we're becoming more and more isolated, but the people around us may also not know how to identify what isolation looks like and what to do if one of us was to become isolated. So my ask today is to keep the conversation about isolation going, to make sure that if we are at risk for isolation, that someone we know will know how to recognize it and to help us. So some of my first experiences with socially isolated older adults were from 2009 to 2011 when I was a Meals on Wheels driver. A simple question we would ask when we were delivering meals is if the individual had left their home and had interacted with others. We hadn't given our questions a name yet, but I could tell very quickly who was at risk. I had seen it and I could describe it. And in 2015, as part of a research study, the questions that I had been asking came together as part of an age-friendly research study on socially isolated older Chinese adults in Toronto's Kensington, Chinatown area. When asked the question of what does social isolation mean to you, this is what one of the participants said. They said, alone, in a sad way. They said, quarantined in society. And as I mentioned, there really is no conceptual agreement about what participants' description of isolation is and what a more sort of academic way of defining the term is. But presented here, the common elements are captured quite well. Those who are isolated lack meaningful relationships, they lack social support, they lack social networks and social contacts. And so I'll spend the next few minutes talking about these issues in a bit more detail, but what I'd like you to think about is when does someone actually realize that they lack meaning in their relations? What about the fact that they don't have a supportive network anymore? When does one realize that? What about the fact that you may go through a good or bad situation and you have no one to call? So what I'd like to highlight at this point is that it's usually at a time of need or crisis and at the point that someone might already be isolated or hard to reach, that they recognize that their relationships are challenged and their social support and networks are compromised. So there's a lot of detail on this slide, but there's a few points that I wanted to highlight for you. In considering support, networks, and contacts that are compromised in someone who might be at risk for isolation, social support functions to allow an individual to be able to pick up the phone and call someone and to feel that they are cared for. It's not just whether they can pick up the phone and call someone, but also whether the person on the other end can and is willing to provide the support that the other person needs, whether it be friends or neighbors, or community agencies, or service providers. In the context of isolation, these are the functional elements or the supportive elements that are important for ensuring that individuals perceive and feel that there is meaning to their relationships. Moving beyond the functional to the more structural domains, social networks are about the presence or absence, in the case of the isolated individual, of relationships that can be mobilized to support the individual. Social networks are about the size of the network of individuals one interacts with, who is in the network, how far geographically someone is, and how often someone might interact with an individual like you or I. Just to give you a few more details about social networks, they can be further understood based on the role of the relationships and how strong they are, and whether they are primarily family-based, those that includes friends and family, and neighbors, and community involvement. So you can see there's a great diversity to the composition of what a social network may look like for you, for myself, or for someone else. When we think about social isolation and the domains of social support, social networks, and social contacts, we should also consider, as I mentioned, the structural elements that consider the presence or absence of friends, families, and neighbors. The functional aspects that help highlight the role of relations and the quality of those relationships with both positive and negative elements. I want to try to briefly put this point into context. Having a number of contacts that is large doesn't mean that those people that an individual can call in case of crisis or emergency, or that the relationships are strong. And so the quality and meaning behind relationships is very, very important. Now, relationships can be few and very strong, or can be many and very weak, which leads me to untangle the issue of whether isolation is the same thing as loneliness. It might feel the same, but conceptually it is different in that isolation is often about lacking relationships, and loneliness is about lacking a feeling of connection or support in the relationships that an individual has. These images, I find them to be helpful for visualizing the differences. The individuals on the left in the group are not necessarily isolated, but may be lonely in a crowd, and the individual on the right, although in the presence of their pet, may be isolated. Let's get back to focusing on you and I for a second. I want you to think about your own social support network, the people you would call on for help or to share a happy or sad story with. Who is in your social network, whether online or in person, and also your contacts? Who are these people? Now, if you would take a second to also think about the people in this image, who do you think is at risk for isolation? I think the answer might surprise you, and maybe it won't, and which is also problematic. I particularly like this image as it highlights an important point that I will return to later. Social isolation doesn't happen overnight. It is both a process which leads to an individual becoming isolated, and this can be related to health issues, loss of income, mental health limitations, loss of a pet, and inappropriate housing, and an outcome as well. And all of these factors put together may work to isolate or separate an individual from functioning in society as they once did. What is important to note is that the outcome can again be addressed through the strengthening or reestablishment of strong, positive relationships. I will spend just a brief moment to talk about what the process of isolation may look like. In this example, I want you to consider this question. How does a healthy, independent 82-year-old get isolated? Well, here are some of the ways in which it could happen, and all the points where the appropriate action or intervention may have helped to address the issues. For example, you can see that there is a fall, there's pain, an individual has stopped driving, there are nutrition issues, and incontinence. Issues that I think could be fairly quickly be remedied and also addressed either within the clinical setting, within the community setting, or in mobilizing the networks and support that I was talking about. And this may be in the way to address the process of social isolation. So I'll try to frame the conversation around these 10 domains and to lead us to the question of whether isolation can be addressed with technology, because we could view that use of technology from opposing viewpoints. Either we can address social isolation with technology, or maybe it is technology itself that has led to a lack of face-to-face interactions and has further isolated individuals, and maybe there's a middle ground somewhere. Now, life changes can negatively impact our ability to maintain relationships, to give and receive support, and also to participate in society in the ways that we used to. A few of those life changes that have the greatest impact are listed here. For example, general declines in health, a death of a loved one, changes in finances, the fact that you might be a caregiver. And so I'll build on some of these points in the next few slides. When we think about the increased risk of mortality, as in the study that I highlighted in the first few slides, mortality is associated with social isolation, and so is the increased risk of long-term illness, hypertension, and the need for residential or institutional care. However, it is unclear whether the medical model of healthcare, which the Western system is built on, which relies heavily on doctors, medicines, and hospitals, holds the solutions. As was evident in the headlines from earlier, there is a greater push for social prescribing and for clinicians to be equipped with the tools and skills to identify those at risk for isolation. Another risk factor associated with social isolation is cognitive decline and poor mental health. Social isolation can change the brain, and a modifiable risk factor for dementia is addressing social isolation, which can address risk up to 2%. Additionally, issues such as hearing loss can not only impact cognition, but may also lead to isolation. What I'm trying to highlight is how an individual may get isolated. So I'm trying to just walk you through the steps of just some examples of what may lead to an individual being isolated, and the things to look out for, not only for yourself, but for those around you. In some ways, those who become isolated because circumstances change, and in other ways, some older adults are purposely isolated and removed from supportive circles in order to be exploited or abused. And elder abuse, mistreatment, and neglect are also associated with isolation. With migration to Canada changing over the last 15 years, especially through the family reunification and refugee class, older adults immigrating to Canada may face language barriers, may have to reestablish their social networks and contacts, and may not receive the social support they need from their families. And so again, this might be an additional factor that leads to the isolation of an older adult, and that there is great diversity in the older adult population that we also need to recognize. Just to build briefly on this point, just a little bit more, the issue of social isolation may be more problematic for older immigrants who face additional challenges reestablishing contacts, networks, and support, and as a result, as is highlighted in this particular chart, may report poor health. Older members of the LGBTQ plus communities may also face issues of isolation, especially when a change of setting may be required and institutional care is needed. Members of this community are at higher risk for suicide, depression, and substance abuse, and often are isolated by having to hide their identity by going back into the closet due to fear of stigma or issues within the context of the institutional setting that they're in now. Not surprisingly, many members of marginalized communities who may be at risk of isolation are also at risk for depression, anxiety, and have a negative outlook on life that may lead them to contemplate suicide. Those who care for us and those who we care for can also lead us to feel lonely and isolated. Caregiving is sometimes referred to as a very isolating sort of responsibility, and caregiving responsibilities lead to one in five individuals reporting loneliness or isolation, and this may impact not only our health as a caregiver, but the care we are able to provide to our care recipient. Interestingly enough, those at risk for isolation, or those who may be socially isolated, may also feel anxious, depressed, or down, and with no one to call, may arrive at a doctor's office and leave with a prescription. What we can see is that antipsychotic medication and off-label use of medications to treat depression and anxiety has increased, and older adults living in institutional settings, also at risk for isolation, in this one example, use even more medication. Setting is important, and so I've been talking about the community and the institutional setting. And whether the individual lives in an institutional setting or in the community, not all communities are the same, and rurality presents its own set of challenges and opportunities to allow people to remain connected, to build strong relationships, and to have contacts. But perhaps social media, WhatsApp, FaceTime, and text messaging can keep us connected and our relationships meaningful. But it does beg the question, and I had alluded to this earlier, of whether social isolation can be addressed with technology or whether technology has further isolated us. And so this might be one of the things that we talk about at the end of the webinar. What may surprise you is that there is a gender role in the size of our social networks, and that social networks of men are often not only smaller, but are tied to marital status. So when we start to think about why social networks change, why social support changes, and why social contacts also change, these are some of the things to keep in mind. And with an increasing rate of gray divorce in later life, not only are social supports, networks, and contacts often lost or divided, there are financial implications. There are housing issues that are tied to this, and caregiving challenges that arise from changing marital patterns as well. With regard to income, older females are often in lower income brackets that are further challenged by increasing life expectancy and raising the rates of, and the rising rates of divorce. Income not only determines our ability to engage and reciprocate in social relations, but determines where we can live, what we can eat. And if you think back to my point about how isolation is not an all or nothing phenomena, and rather a process, this is what the process looks like. It also determines, what our housing situation is like, whether we're living alone, and again, about social support and social networks and social contact. Reciprocity is a very important factor. Retirement, too, is a risk factor for social isolation, as many of the meaningful relationships and one's identity might be tied to the workplace, and oftentimes due to ageism or health-related changes or caregiving responsibilities, one is left without an option with regards to their participation in the workforce. And ageism, is at the base, is embedded within retirement policies. It's a very discriminatory social process, and retirement has been a very challenging time for many people. Not being able to drive may also compromise our ability to have meaningful relationships or to volunteer or to engage with our social contacts. A majority of older adults drive, and health changes oftentimes lead to the restriction of driving, and this is particularly challenging for older women, many in this generation who may have never driven. Going back to our earlier discussion of support, networks, and contacts, many of our meaningful relationships are built on exchange, and as can be seen, women are more likely to participate in activities that can help build or maintain those important relationships. Some of these examples are related to family, friends, spirituality, club, and other volunteer activities, and these are highlighted in the two graphs that are on the left and on the right. And again, you can see the role of gender and increasing age in determining what types of activities people are able to participate in or are currently participating in. When asked the question of what does aging mean, many of the answers are based on a view of life through a very sort of deficit lens. Physically older, loss of mobility and independence, loss of mental capacity. Think about the word social isolation. Social isolation, the word, if we unpack it, social tied to friends, isolation, being away, separated, quarantined, as one of the earlier participants had mentioned, suggests a very sort of negative association with social isolation and it being tied to aging. We want to think about this also in terms of the social isolating mechanisms that ageism plays, and how people also internalize social isolation as a normal part of aging when it is really not. Well, I can tell you that one of the more surprising things that happened to me while participating in research studies is that I recognize the commonality between a lottery terminal, a bank, and a church, and a food court. I learned while conducting research on social isolation is that the places you regularly and routinely show up are the places where people will most likely recognize your pattern of absence as well. So whether that be at a lottery terminal, a church, or a food court, if your relationships are meaningful, someone will miss your presence. And we have to make sure that they know what to do for us if they recognize that we haven't been where we usually are for an extended period of time. So what can we do to add meaning to our relationships, to be able to give and receive support, to have and be part of a social network, and to maintain or increase our networks, for example, if we've migrated to a new country? Groups can be very helpful, not only for dealing with the issues that lead to isolation and the risk factors, but also to help with establishing new networks with others. And those groups can be supportive, educational, or related to sports and volunteer activities, as highlighted on this slide. Volunteering is also an option, but with volunteering, I want to add a little caveat. And my suggestion is that we should start volunteering before we feel like we have to, in order to make new contacts and to feel that we have purpose. A quarter of Canadians volunteer, and this may be one of the more simpler ways to address risk factors for isolation. When we think about service providers and those who are at the front lines and may be in a position to identify those who might be at risk for isolation or who might be isolated, service providers too recognize the need for everyone to work together to share information and resources, such that older adults can be better connected to services and to each other, but also that the service providers are connected to one another so that it's easier for them to identify someone who's at risk, to assess someone who's at risk, and then to refer them to appropriate care. As I had mentioned in the beginning of this webinar, the age-friendly community movement has put a lens onto some of the issues that lead to isolation and has helped promote active and healthy aging. There's a lot online about age-friendly communities, and I would encourage you to better understand the various domains. Something to focus on is especially the two domains that are related to social inclusion and social participation. I will highlight a few more opportunities with regard to isolation before I finish and take some questions. In many areas of the City of Toronto and elsewhere across the country, older adults have aged in place and naturally occurring retirement communities have developed. And our goal should be to help maintain those communities, to allow older adults to remain connected to the services, to the people in their communities and in their homes as long as they can, and to ensure that they remain part of a network, that they do receive support, and that they're able to age in place. One of the programs that I helped lead last year, and it was a very successful program and helped address isolation, was the Toronto HomeShare program. And in that program, we helped older adults share their homes with university and college students. The results were very positive, and all of the participants agreed that programs like this one, based on an intergenerational model, which addresses things like ageism and also brings people into contact with one another, could help address isolation and also allow older adults to remain in the community for as long as possible. Some of the other programs, one of them that I mentioned that I participated in which was the meal delivery service before Uber Eats and other options that are now available, was Meals on Wheels. And we might be able to better utilize these programs to improve and provide social contact and to address the risk factors that might be related to things such as transportation, the inability to prepare a meal, or financial issues that someone might be facing, and also to re-examine libraries and recreational centers for hubs for interaction. So as I come to the close of this webinar, I want to bring us back to this image. As you may have guessed, almost everyone in the image and all of us are at risk for isolation and the health changes that are associated with aging. They may not happen to all of us at the same time, but they might. Retirement, late life divorce, housing changes, loss of driving capability, migration might be some of the issues that compromise our relationships, the ones that we've built over a long period of time, and challenge our ability to maintain social contact and networks that we currently have. So I want to highlight one of the things that we are working on right now, which is to be putting together best practices and policies. And so we are working with the National Institute on Aging. And when I say we, I'm talking about myself and members of the National Initiative for the Care of the Elderly, and the National Institute on Aging, which is Dr. Samir Sinha and Michael Nyson, and our scientific director, Dr. Lynn McDonald. And one of our goals has been to synthesize the existing knowledge and to bring forward some great ideas that we've seen, the best practices and policies with regards to social isolation. And we've been very grateful for the funding support from the RTO, and we look forward to bringing forward some of those recommendations, policies, and practices to show what works in the domains of social isolation in the future. And in concluding, I want to remind you, and myself actually, that social isolation is both a process and an outcome. And as an outcome, it may be much more difficult to address, as isolated individuals are hard to reach and may not even realize that they are isolated. So we need to look out for each other and to equip each other with the knowledge about isolation and what to do. And so just as a brief summary, I've had a chance to talk a little bit about what isolation is, who this might impact, some of the risk factors to look out for, a few changes in settings that might be something that we focus on again in the future. And I look forward to sharing some more best practices and policies with the RTO and the RTO Foundation and all of you in the future. In the meantime, if you'd like to connect with me, this is how to best reach me, through email or phone or social media. And I'd love to open it up for some conversations and to take some of your questions. And again, thank you very much for this opportunity to speak today.
Thank you, Dr. Mirza. We will now spend some time answering questions. Remember, everyone, you can use the chat box at the bottom right of your screen to submit your questions. I have one for you.
Okay.
What of all the risk factors, which one would you say is the most dominant for social isolation?
Well, I'll tell you the one that I think from my own personal experience that has been very problematic. And I'll give you 3 examples. And when I spoke last year at the PRCC meeting, I had given the example of my neighbor, my father, and my grandfather. So my father went through retirement, and I think one of the bigger issues is retirement. When my father had gone through retirement, he had retired at the age of 49. When my neighbor had retired at what is considered the set age of 65. And my grandfather had retired and migrated to Canada in his 70s. So I think that retirement was a real challenge for my dad, especially because retirement is seen as something that happens when you're older. But when he had retired at 49, he became very disconnected from the social networks that he had created at work. He lost a sense of identity that was tied to his sort of workforce contribution. My dad was a biochemist, and he had a very strong contact network that he engaged with on a daily basis. I would also say that his days were structured around going to work and mealtime, and all of that changed as of retirement. And I would say that that was the same sort of thing that I saw that happened with my neighbor. My neighbor who went to work for 40 years, all of a sudden in retirement had a full day with nothing to do, and had lost contact with the people who were still working. And so these were challenging times. And my grandfather, as a result of retirement and migration, lost his income, he lost his social support network. And so these were very challenging things. And to say that in retirement, if your relationships aren't strong and they don't translate into your retirement activities or the way you socialize in that sort of domain of your life, it's challenging to rebuild meaningful relationships and to rebuild networks and to rebuild contact. And so from my own personal experience and from what I've seen people go through, retirement, if people aren't prepared for it financially, emotionally, and don't have volunteer activities to fill their time, it's a very challenging period.
Thank you. If I were looking at one of my friends and I suspected they were socially isolated, how would that look through my lens?
Well, I think one of the things that I was trying to frame in the beginning was just that the way we understand it and the way we can describe it is different, because how do we really see a meaningful relationship or a meaningful social contact or a social support network? But I would go back to the example that I gave about the food court and the church and the lottery terminal. So if you have sort of a routine engagement with this friend and you start to see them not showing up to those things, or if in the past, if they had good news, they would call you and share their good news, or if they were troubled by something, that they would call you and share that news with you and rely on you, and they stopped doing that, I think that's a real indicator that something has changed and an opportunity for you to inquire about what some of those changes might be. And you might see that they are on their path to becoming more and more isolated. And some of the factors that I highlighted earlier might be playing a role there. Okay, so I'm just going to scroll through some of these questions. For seniors that have been hospitalized and waiting for long-term care, they can wait for a very long time. And since the hospital is not set up for stimulating these patients, what strategies might you suggest to assist these people to maintain their social and mental well-being? I think this is a fantastic question, and I have to tell you that one of the things that I'm really worried about is the fact that while people are waiting for long-term care, we know recently in the news there was 37,000 people who are waiting for long-term care. And while they're waiting for the appropriate care, they're still living in the community, and that their homes may not be the right homes for them anymore. The support that they had may not be the support that they need anymore. And so we have to look at new ways of reimagining our communities. I think the Age-Friendly initiative gives us a lens for allowing people to function optimally and to have the best well-being while they're waiting for supportive care or to transition into the next space. The example that I can give you is the one where if we strengthen the communities and the services in the communities, we can take a lot of the things that we would find in long-term care, retirement residences, or assisted living, and take those things from point B back into point A into our communities to allow people to have good quality of life and good well-being while they're waiting for long-term care. Because to build on my worry, if we don't start to do these things, what we'll see is that when people do get to long-term care, if they do, that they're actually going to have they're going to have much more to deal with, and that they're actually going to be sicker and worse off than they were when they needed long-term care. So this is how I would address it. And again, the HomeShare program that I mentioned that we are working on right now has been very sort of helpful in addressing some of the concerns that people have as they're staying in the community and waiting to move to a retirement residence for long-term care. Okay. So I'll just keep going with some of these questions as well. I'm a full-time caregiver for 7 years, and my husband is 14 years older than me. He has dementia, and he is stroke disabled. I'm always lonely, though I'm with him 20 to 22 hours daily. How might I feel less lonely? So I want to first start off by saying that I'm sorry to hear about some of the challenges that you're facing. I was a caregiver for about 21 years, and while my father didn't have dementia, I do think that dementia presents additional challenges and worries. So, I also want to tell you that it was a real important opportunity for me to be a caregiver. But if you're spending 20 to 22 hours daily providing care for an individual, there's not much time that's left for yourself. And one of the things that I'll tell you is that what I learned is that we always want to be providing care to our loved ones for about 24 hours a day and 7 days a week. But in the slides and in today's webinar, I had also mentioned that care recipients feel very isolated or lonely, and 1 in 5 of us. I can tell you that I felt very isolated and lonely in providing care for my father as well. And that at some point I had to recognize that giving my father about 4 to 5 hours worth of care actually improved his well-being and my own. And so the relationship is very reciprocal between the care recipient and the caregiver. And so you have to be able to manage your own health and well-being to be able to provide the best care for your care recipient. And that's something that's very important to keep in mind. I think at the point where you are providing between 20 and 22 hours of daily care, it is simply an issue of being isolated and not having enough time to reach out to your friends and to your family and to your neighbors. And it might be time actually to ask for help. And that help might be professional help, or it might be informal help from your family and friends. And that might help address some of the issues that are causing you to feel lonely, even though you are in the company of your loved one. And also, this has led to your isolation as well. So I would say that might be the first step in doing that. I think this is another question that we have here is I would like to know where to go if you are isolated to meet more people or be involved in more activities. A list of those resources should be given by RTO and the board to all retirees. And I think this is a fantastic idea. I think that the individuals that are isolated and sort of have the self-awareness to recognize that they are isolated are in a better position than those people who don't recognize that they're isolated. That's the first point that I'll make about that. I think there are activities that are embedded within each one of our communities, and they're available through the libraries, through volunteer opportunities. But there are also employment opportunities that you might want to consider as well. And so isolation really comes down to building and maintaining meaningful relationships, having social contact with people, and like I mentioned, having people that you can rely on and trust and pick up the phone to share, when you're happy or when you're going through a tough time. And so anytime I think that you can engage in interaction with people through volunteer or sports or spiritual, that might be the way to do it. The one that I know that works very well is the issue around communal dining. And so communal dining clubs have been very, very beneficial for older adults over the age of 55 who dine together. And so there might be a meal club that you might join. A friend of mine, a colleague of mine who's in his late 40s, has actually joined a communal dining club and has found it to be very beneficial, not only just to strengthen his network, to socialize over meals, but also just to give him something to look forward to at the end of the week. I think this is a good question as well. So I'll read the question out. Is how do we, prevention and addressing the issue of isolation is most important. So I think I would agree with you on that point. And I've been highlighting, just through the original slide about the healthy, independent 82-year-old individual. There's a lot of touch points there that clinicians, community workers, friends and family members could recognize and address social isolation so the individual doesn't get isolated. I think, how do we help you? And the second part of your question is, how do we help younger people prepare for the future? So I think I want to address the issue of isolation as not being just tied to age. And that social isolation, what I've learned, is something that can happen to you at any age. If you don't feel like you have meaningful relationships, if you don't have a lot of people that you can call on. And so what we need to do is we have to recognize first that social isolation isn't tied to age. And second of all, we have to start to work together to figure out how do we interact with one another in a way that the relationships and contact is meaningful, so that the bonds of friendship are stronger. And so we have to have opportunities. And I think intergenerational engagement is one of the ways to do that. So through intergenerational schools, through age-friendly initiatives, through programs like the one I know very well, which is the HomeShare program, we've been able to help address some of the things that are, again, like I mentioned, not limited to age or just about growing older and being isolated. So the other point here being raised is that social media really does help people communicate with faraway loved ones, and I don't want to take away from that. I have to tell you that if you could hear, I know this is a very sensitive mic. My mom has been messaging me good luck and other things over the phone, and in our busy lives, even though I live with my mother, it's one of the ways that we do keep in touch, and we do add meaning to our lives this way. And so technology in many ways is our mode of communication. And building on the previous question about how do we prepare the younger population for this future? Because what my fear is that we're actually going to see an increase in isolation as this generation grows older and interaction has been through a technology-based platform. So yes, I do agree. I think we just have to harness the potential of technology to help us address isolation and to build on it and use the positives of it rather than seeing it as something that isolates people further. So how does a hearing deficit impact social isolation? This is a very important question. So I'll frame it to you in a simple way. And this is, again, I'll give you an anecdotal example from my real life. I know a set of individuals who are in their 80s, and one has hearing loss and did not address their hearing loss. And then there is one who addressed their hearing loss. And the individual who addressed their hearing loss continued to go to the movies, continued to go to dinners with their friends. And the one who didn't, over time, felt embarrassed by the fact that they couldn't hear things and didn't want to be seen with a hearing aid. And because a hearing aid became symbolic to them of being older and aging, and so they didn't address their hearing loss. And what they found was that over time, their embarrassment and the fact that they couldn't hear led them to disengage from the social activities that they participated in. And so that's just one of the ways that hearing may impact that. And hearing is, again, one of the senses, and so you can see how it's tied to cognition as well. So this is a very good question as well. Actually, they've all been very good questions, and I like that you're making me think about things in ways that I have not thought about. Are there sources of financial assistance for seniors on minimum income so they can afford to do things that will help keep them from being isolated, especially when they are still able to stay active? So the income piece is very, very important. I think the income as a social determinant of health is one of the most important ones, and we can debate whether it's housing or it's income, but income determines your housing and whether you can go out to eat and whether you can go to the movies. And what you can see in recent results that have come out from, it might be Statistics Canada, is that the lower the income group that you belong to, the less likely you are to volunteer, the less likely you are to engage in activities outside of the home. And so I don't have specific examples for you with regards to financial assistance, but I do know that there are opportunities for individuals who are low income to receive subsidies to participate in lots of programs. And so this is one of the things that I can look into for a little bit, into this issue a little bit more. And I do know that one of the other ways that, I know this is not the most popular thing, but there are volunteer opportunities as well where you don't require an income to participate in programs. There are also groups that meet up that are low cost or free, and that Facebook is actually one of those ways that people have been able to connect. And so I know the RTO Foundation does have a Facebook group that was very active. I know, and so that might be one of the ways that you start to learn more. So here's another question. I'm just going to read it out loud. In our research, have we noticed it's gone down. In our research, have you noticed a difference between people who identify as introverted versus extroverted in terms of their isolation and or loneliness? In my work training people to facilitate engaging conversations with older adults one-on-one, I've noted that many people prefer to have a conversation with one person rather than join a group, activities or events. And so I would say that when we talk about introverts and we talk about extroverts, it's not necessarily about age. And I would say that older adults and younger adults have a preference either for one-on-one or to be in a group setting. And some people just operate better that way. What I have recognized is that people let me go back to the quote earlier where it said, when you think about social isolation, a research participant said, alone in a sad way. And we think about that quote and say, alone in a sad way. That also highlights to us that sometimes people just prefer to be alone, and that's okay. But when we think about social isolation, that person sees alone in a sad way. And so sometimes actually people prefer to be alone, and that's their preference. Isolation is different from that. It's actually not your preference that you're stating there or activating. It's actually being isolated, either physically, socially, or emotionally, away from a group. And so even though you want to interact or pick up the phone, you're unable to do so. Does being sort of introverted or extroverted have something to do with it? Absolutely. And so the way I think about introversion and extroversion is through the fact that you may not have built meaningful relationships with a lot of people. Your social network might be smaller if you're an introvert, but you might also have a lot more sort of depth and quality to those relationships versus an extrovert who has a large social network and a large group of contacts, but actually does not have a lot of quality to those relationships, and they're actually not meaningful. So that's the way I would think about that one. And yes, I do agree that there are lots of people who state a preference about whether it's an individual or a group setting. I'm just going to keep going down. For LGBTQ seniors, the prospect of communal living or moving to a smaller community to stretch limited finances can be terrifying. Any strategies to deal with this? Well, it's challenging, absolutely correct. And I think despite being part of the LGBTQ community, I know that adds a layer of complexity to it. But moving to a smaller community is actually, again, I had mentioned earlier, a lot of the individuals that we've worked with who are part of the LGBTQ community say they feel marginalized already in a place like Toronto, which is a big city, and having to move to a smaller area because their finances are stretched in Toronto and they have to unlock the assets in their homes. Um, One of the strategies, again, and I hate to bring this up again, this is a project that we've been working on, is the Toronto HomeShare program. In the Toronto HomeShare program, we did have members of the LGBTQ community participate. And what the program actually does is it allows older adults to harness the potential in their homes. For example, if they have an extra bedroom in their home and they want to share that home with a student, they are able to share their home, earn a little bit of income, which is about between $400 and $600, which equals about $7,200 for the year, and also to get some help around the home. And building on the point that I raised earlier about people moving out of the community into other communities or into institutional settings, what we've tried to do with that model and others that might be out there is to take all the things that would be in point B, so whether that's in a small community and an individual moving to a small community because it's actually cheaper to live there, what we've tried to do is actually make it more affordable to live in your own home here by giving you a way to access a little bit more income and support by having a student or someone else in the home. So this might be one of the ways that we can think about it and reimagine our homes and in our settings to allow people to, again, age in place. Okay. Brownie and Girl Guide chapters look for visitors to tell kids today what it was like 75 years ago. Offer to pick up and deliver a senior to a meeting. So I love this comment because it highlights the real potential of intergenerational engagement and for addressing things like ageism, which are at the root of things like retirement, and also lead people to feel isolated and marginalized within society, within the educational setting, within the workforce, and oftentimes make people think that isolation and a loss of a social network and social contacts is a normal part of aging. And again, building on my point earlier, which was to say that we actually have to look out for each other and we have to help each other. Equipping younger individuals with the knowledge about social isolation and preferences and things like what it was like 75 years ago, I think gives people context about aging, about the individual. And I think intergenerational engagement is also one of the areas that we should explore more for addressing social isolation. One of the questions that's come in is, what do you know about the stress for older persons facing new technology? So I just presented something about knowledge translation on Wednesday night last week. And what I can tell you is that older adults are actually adopting technology at a much faster rate than is assumed. And so there is a real myth that older adults are inept with technology. And as I mentioned earlier, that my phone's been buzzing because my mom's messaging me. My mom is 65. My mom has been using technology for the last 5 years. My grandfather in his 80s had learned to use a computer on his own and to use technology. And so while there might be a bit of stress and apprehension on the part of the older adult, I can tell you that my mother and the older adults that I work with have no issue whatsoever with technology. There is some stress. I think just some ageist stress that might exist, where an individual doubts their ability or is seen by somebody else, potentially in the workplace, as not being able to learn or adopt new technology. But I think the stress is it's not for older persons as it is for at any age about learning something new. It's a bit of a learning curve, but an older adult, just like a younger adult, is able to learn and master anything at any age. And so the message that I'm seeing now is that this is our last question. So I would say that this is our last question for this webinar, and I'll encourage you again to find me via email or phone, Twitter, LinkedIn, or whatever your preference is, and that I hope we'll be able to keep the conversation going. I've learned a lot also from talking to you, and I really appreciate this opportunity. So thanks very much for having me.
I want to give a big thank you to Dr. Mirza for being with us today and sharing his expertise. And thank you everyone for joining. Please take 1 minute to complete the survey that is up on your screen right now. In closing, Please consider visiting the RTO ERO Foundation online and making a donation so we can continue to fund important research, share knowledge, and raise awareness on issues affecting older adults. Thank you to everyone who participated, and again to Dr. Mirza.
Thank you.
Thank you.